Hello, this message is on health literacy, social media, and older adults, 2023, July. The 21st century continues to allow many people across the globe the opportunity to connect via the World Wide Web, and in the last decade, connect on social media platforms. As our U.S. population gets better with age, social media offers ways in which people can obtain health education and become more literate. Do you use social media to access health information? How do you decide which platform offers the best health education to strengthen your literacy? My mission, in part, is to share a few ideas for consideration so that you'll be further informed to make sound decisions and become even more health literate online. Did you know that in 2020 there were close to 56 million Americans over the age of 55? This is according to the National Council on Aging. That's the equivalent of about a third of the entire population and also approximately the similar population size of the country of Kenya. Who would have thunk it? That's according to World Population Review. It's important to know how to navigate through the convenience of social media for our best health experiences. Let's discuss a few of the terms I mentioned previously. Health literacy is the ability for a person to understand health terms to make informed decisions for themselves and others. As we age and educate ourselves regarding the best health information for decision making, time and cost savings also help us to see social media access to health care information a welcome option. So, how do I get on social media? The usual access points require a computer, laptop, or mobile phone. On compatible technology, service providers offer internet service via the World Wide Web, and this is where you and I can access web-based applications such as Gmail or Instagram. In those spaces, people create and exchange information virtually through options like blogs, as seen on Twitter, content communities, as seen on YouTube, and social networking sites, as seen on Facebook and LinkedIn. This said by Sumayyia and Associates in their report in 2019. The intersection between health education, obtaining health literacy, and alternate ways to communicate outside of personal physical contact are available through social media. This arena allows for connection to resources and conversation that enhance health literacy on social media. People are deciding to travel more as they move towards their retirement age, embracing new joy with hobbies and education, volunteerism, maybe some consultant work, as well as connecting with family and friends in a greater way. Wellness becomes an even more pivotal idea so that these engagements might have bear more fruit. It used to be that resources in order to figure out how you're feeling better would be calling a relative, leaving a message with your doctor, or making an appointment to see your physician, checking out a periodical on health, popular magazine, um, or some brochure on healthcare information, and those things are good. But nowadays, we're able to simply access the internet to find the health information we want or to be pointed in the right direction. What is your virtual spot for sound health education on social media? How are they helpful and what should we avoid on those sites? What happened in recent years to challenge our decision making about how we look at health education and how we become health literate? So let's talk about how many people sought health education surrounding the COVID-19 pandemic and some of what transpired. In late 2019, the world witnessed the beginning signs of people becoming ill, but with no definition of the why. Over time, the sickness labeled COVID-19, also known as coronavirus 2019 version, would overflow significantly beginning in the year 2020, primarily through countries such as China, Europe, the United States of America, South America, Africa, and Asian, those continents as well. Cities, states, countries began what was called a lockdown policy. This was a prevention effort to minimize the spread of COVID-19 vaccine virus within communities, public spaces, and private dwellings. So public service announcements went out, and people started to learn that it was safer to no longer congregate in circles beyond their immediate family. This also included um, not being able to go to public events at theaters, dining in restaurants as a sit down option, going to any sort of entertainment venue. And it also limited access to doctors. So these physician offices began having virtual appointments, leaving many to use emergency rooms and urgent care facilities as their new health care service provider because of COVID-19 um, infection rates. As society became a type of home hostage, many sought information about prevention of COVID-19 and how to be safe. Many also did the opposite, according to Reuters. Some of the social media engagement happened on Facebook. Many people, in the effort not to spread COVID-19, saw connection there versus their usual routines of workplace, civic, and social locales. As news reports from the USA's Center for Disease Control and the global entity World Health Organization, and alongside news media outlets, all began to share information on how to stay well and stay alive. Social media allowed for conversation on how to do just that. Discerning what the best information was virtually became onerous for many. Stifled with over information or infodemic, uh, there was fear. There was fear surrounding a condition that medical authorities were also attempting to understand that made discernment difficult as the public service announcements changed often. And according to a Pan American Health Organization and World Health Organization study in 2020, this overabundance of information included misinformation through social media. We can now see how shared information from sources that might have been from friends and relatives and colleagues and well-meaning strangers didn't necessarily include references from reputable sources like science-based advice or notifications from well-known researchers from places like the National Institute of Health or a major hospital system known for quality care and equipping people who normally would be able to provide information via social media that would be considered trustworthy or even to offer advice with the gaze that it would be scrutinized before released. The dark side of infodemic is that people easily felt overwhelmed by the suggestions. Looking at the infograph in this series, what things seem familiar to you 3 years after the COVID-19 outbreak? Trusted sources, epidemiological updates, while reading through local and international news and hearing all sorts of opinions was taxing to many. Those who did well sought out these things and weighed the pros and cons to find a sound solution to how they managed during the pandemic, were more likely to do well. Those people also had the ability to shift with updates when they found the information to be trustworthy because of um, scientific review and the learning, and also learning about the successful outcomes of others, as well as learning from situations that were similar to those that they were experiencing themselves in wake of COVID-19 lockdown. Another byproduct of information overload included news topics tied to the pandemic 2019 to 2022 and the idea of hoaxes. This label was associated with anything that appeared to be true but was either partially correct or fully false. Some social media sites such as Facebook and Instagram, as well as YouTube, created, held, and distributed these messages that challenged health literacy. One of the most popular ones was WhatsApp, where there was the sharing of memes and ideas on wellness that were not backed by scientific data, or conspiracy theories that fueled flames of fear. These things and more aggravated most people and caused a severe distrust in what information they were getting in terms of how can I stay well or alive in COVID. People found comfort in the hoax because it felt like they were getting information that was going to be helpful to them. But in reality, it was problematic. So one of the things that happened is that people needed to learn how to determine what health information was sound. Furthermore, when we look at how information is shared, we're reminded that another place of importance was the role of social media being on 24 hours a day, and how that over getting that information over and over again was problematic, as people were still trying to digest multiple sorrows, learning about people getting sick, dying, hospitalized, and all the fear surrounded that. Additionally, many people started relying on these false stories because they were tired of being isolated. They didn't want to believe COVID-19 was as bad as it was. The president of the United States at that time, Donald Trump, also considered it to be more of a flu-like condition and not as serious as the scientists said it was. These things and more led a campaign of toxicity, where people conversed, misinterpreted, attacked one another with frustration in order to work out whatever was going on in their heads. Toxicity was at the forefront, and digital health literacy wind up being challenged by low literacy people who are often misled by exhaustion or misinformation, sometimes both. There were Pascua and Ferreira 2021 surveyed how many hashtags for social media information included markers to remind people to wear a damn mask. And as conversations and confrontations on and offline escalated, public health officials continue to give updates on protocols for prevention with the hope that these actions would combat volatility, misinformation, and other harm doing. In this case, social media served as a double-edged sword. It was saturated with lots of opinions and unsubstantiated claims, leaving low literacy people feeling even more frustrated, angry, unreasonable, and sometimes dangerous. In the beginning, there was a quest for public officials not to buy hospital grade masks, for example, because there was low supply. But then, over a course of time, they realized that people needed to wear masks. That became a problem, and people pushed back. So many people in society decided they did not need the mask. Others decided it would help save lives. Conflicts ensued. It became a new medical dilemma amongst epidemiologists, researchers, hospitals on how to safeguard themselves and society. As the answers continue to change somewhat, people who had low health literacy acted on that and used that as a catalyst to support their position. The toxicity rose from so many debates on social media that many people could not tell what was the truth. By the time we had gotten to the end of 2020, Thanksgiving, travel warnings and this a feeling of this is not a serious condition was proclaimed by President Donald Trump, even after he contracted COVID-19 and recovered, justifying that it probably was just a really bad flu. The research showed that toxicity undermined wellness and civility on and offline. One of the things that seniors, adults over 55, can learn from all of these incidents, including the fact that American university students also found themselves victim to wondering whether or not information was true or false, that the need for health literacy is not tied to a particular age group. All of us require health education, sound, resourceful information from credible, trustworthy resources, and we are reminded that the need for digital health literacy to be conveyed on social media remains a great way to share information across rooms, states, and nations. It is important to understand that finding multiple ways to engage people who are hesitant to social media, government intervention, prone to believing conspiracy theories must be met in a new way to help them figure out how this information highway, the internet, can assist them in the things that matter most about their health experiences and knowledge. It is imperative as we face the latter years of our lives to have the best health literacy and know how to feel competent as we apply what is needed for the outcomes we want and desire.